Well, thank you all for sticking around for the end of the day. I would consider this to be a successful day for the Department of Human Services, the Division of Medicaid, for Department of Health, and for the public health, actually, of the territory. We want to say thanks for, and our stakeholders, because we have many stakeholders that actually stayed behind us today, so thank you so much. We want to say thank you to our special guest for being here today. He's no longer here with us, but we appreciated the words that he used today, and that is our Honorable Tregenza Roach, our acting governor, the Honorable Novelle Francis, the President, Senate President, Basil Atley, Director of, what are you, Basil? Director of Policy, Office of Insular Affairs, Department of Interior, Christina Galanis. Thank you, Christina. Chief Strategic Advisor, our panelists and our moderators, in particular Dr. Mark Johnson, who's a professor and chair of the Department of Community and Family Medicine at Howard University, and Dr. Chris Gibbons, Chief Health Innovation Advisor at NHIT. Thank you all. Thank you, Commissioner Kim Kazi Gomez, for your continued willingness to partner with the Department of Health, not only on this, but on all efforts and all counts. So we really appreciate you. And of course, thank you to a team of two. Louis Belen, Chief Executive Officer of the NHIT, and of course, the Department of Health's Public Health Advisor, and former Delegate to Congress, Donna Christensen. Thank you so much for making this possible today. There are a few people who actually said some key things, and as the day went on, I kind of captured some of them. Senator Francis called this a watershed moment, turning point, a moment that changes the direction of a situation. He went on to quote Narendra Modi when she said, "Innovation no longer remains a choice, but has become imperative." Christina compared HIE to an octopus brain. In the middle, that is a brain that speaks to all languages. We now need to normalize and translate that data or that language and define the next steps to where the data leads us to. That's important. Dr. Ellis spoke about population health versus public health. Data supports changes for population health, but will affect the people and communities within our territory. Mr. Smith also spoke of having a revenue model that refers to our efforts to support the HIE. Performance-based budgeting, one means of securing future funds, as Basil spoke to as well. Mrs. Webster has used data collected to reduce challenges within transportation, one of the non-IT local social determinants of health that we did not speak much of. She noted that health information exchange is a game changer on steroids. I think that one is going to follow you, Mrs. Webster. You want to continue? Dr. Michael, she spoke to being able to use student researchers to build data sets to meet the needs and provide the capacity building for those needs. We had some goals that I saw developed throughout the day: improve the territory's institutional capacity, improve interagency collaboration to include human services, health, hospitals, federally qualified health centers, private, non-profits, and people. Provide venues and recognize the concerns that people of the territory may have with the implementation of the HIE. Improve the overall health and safety of our health and human services systems. Reduce health disparities and decrease the disease burden. Improve the quality of life and increase the longevity. Improve connectivity and communication. Develop a health ecosystem that meets the diverse needs of our community. Data-driven decisions from the information derived from our information exchange. Allow the efforts of HIE to play an integral role in developing our smart islands. Strengthen the healthcare safety net in the territory. Assist in preparedness for hurricanes and other disasters. A fully operational health information exchange as of 2021. Update public health registries, adopt meaningful use, include the Department of Education and the University of Virgin Islands in our efforts to building a workforce with the skill set to manage our HIE and other IT innovations within the territory. Capacity building to ensure sustainability. build a cohesive government structure and the development of champions to governance structure, and development of champions to ensure progress of the process of implementing the HIE. Work with external groups to improve interoperability, interfacing between systems. Addressing the needs of population health by mapping disease burden, assist in building the case of bridging the gap of healthcare needs as behavioral health or gerontology. Support for transitional research with the use of de-identified data. Creation of policies and laws surrounding HIE. Development of evaluation systems for HIE using culturally sensitive data that's captured. Educate, educate, educate. Some ideas: identify the future capital needs that will be required to sustain the HIE in years to come. Use incentives to encourage the people to use smartphones in identifying social determinants of health within a territory, which may be somewhat different from what the social determinants of health we see within the mainland. Complacency will no longer be our comfort zone. You can now look forward to innovation and action. All you need is a little bit of faith, dust, fairy dust, and a little bit of pixie, faith and a little bit of pixie dust, correct? Something like that. Kimberly? You going back on the red
stuff? No. Thank you so much. This is really loud. You're awake, right? Right? Okay, good. That was my point. It is a pleasure for Human Services to collaborate with everyone. And being that I'm back in a territory and relatively new, it's exciting. It's a really exciting time, and I have a lot of energy. If you didn't notice, I wake up with it and I go to sleep with it. So I am extremely thankful and blessed to be able to work with such wonderful people. And there's a lot of people in this room that I've known for a very long time. And so for me, that shows commitment and persistence. And so we don't give up. And that's the thing. We never, ever have given up from day one. So I'm very thankful. Just a couple of words that came to my mind, eloquently typed up. Of course, mine looks like this, which is how my mind works. But patient-centered. We are one people. We're doing it on a holistic approach and a multidisciplinary team. So together we can do it, and we will do it, but we can't give up. So I thank you all for your time and attendance today, and your appreciation and your interactive approach. Enjoy your evening for your Monday. Thank you.
Thank you all.